Let's look at step one of the home program, the corrective exercise done to help reset your upright pelvis. Remember, discontinue the exercise immediately if it is uncomfortable to do. We recommend that you do this exercise at least twice daily, once in the morning as you start your day, and again in the evening, just prior to going to bed. To create a slight incline for the exercise, I use 4 pillows, and I'm just going to line them up like this. I'll stack them 1, 2, 3, and then I put the 4th pillow on top, and that gives us a nice angle for Laura for the exercise. How about, Laura, if we have you sit up on the edge of the table here? Sure. And then just with the good body mechanics, why don't I have you actually start by just facing towards me? So we'll do that. Yeah, there you go. Let's have you rotate, go down on your side first. There you go, and then rotate side to back. Okay, and I'm going to purposely scoot you pretty close to this edge of the table. Okay. Okay. Are you comfortable? Mm-hmm. Okay, so this is the corrective exercise, and one point I really want to make at the beginning of this is you absolutely stay within your own comfort tolerance when you do this. So if you start getting into any angles that do not feel comfortable to you, you stop the exercise immediately. So it is absolutely done gently and within your own comfort tolerance. Okay, so let's start, Laura, and what we'll do here is we're just going to bring that right leg up in a straight line. We've got the leg at about 45 degrees. You notice my hand position. I'm under the leg, and I'm actually just on this side of the ankle. This is really important, Laura. You need to really have your leg completely relaxed to do this. So you tell me when you feel like you've let the weight of your leg really just drop into my hand. Okay. Okay? This is with a very light, gentle grip with my hands, and this is a very gentle pull. All I'm going to do is very lightly bring the leg out in a straight line as if I'm lengthening it a bit. Okay, and then I'm going to do a slow count to 5 while I am lightly stretching it. 1, 2, 3, 4, 5. Okay, so that's the first part of the stretch. Now you let that knee bend. You're going to just now steer the knee just wide of the belly, and that brings the foot in a little bit, so it's kind of just a natural angle here. Laura can do this part of the stretch completely by herself. And what I'm going to have you do, Laura, is if you can come in with your right hand on your right leg here, I'm going to say about right here. I just want to point out a few angles. It works best if you do keep the knee at 90 degrees. So in a sense, you don't want to bring your leg this way. What we're really trying to do is we're trying to stretch the knee towards the bed surface, so try to stay at 90 degrees. And what you're going to do is you're just looking for either the beginning of resistance or any sense of discomfort, you would stop. Okay, so very gently bring your leg in this direction. Tell me when you feel like you're starting to run into a little bit of resistance. And then once you feel like you've hit that light resistance, you're just going to very gently counter push with the leg now, Laura. So coming up. 1, and why don't you count out loud? 1, 2, 3, 4, 5. Okay, and then you let the leg completely relax. Once you're relaxed, now you're just going to gently stretch again until you feel like you run into a little bit of light resistance. And you see how the knee was able to get a little farther back. What you're doing really is you're getting that really nice posterior rotation on your pelvis. You're reversing the pressure that was created by the baby's weight in your belly. Okay, very gently counter push again. 1, 2, 3, 4, 5. And relax. And then, again, that light stretch going down. Okay, and then one more time. 1, 2, 3, 4, 5. Okay, and give it one more good stretch. Good, and then we're going to let this leg rock all the way back. Okay, after you do one side, and you can start on either side. If you do have discomfort that's more focused on one side than the other, I recommend you start on that side. And then you just come around the other side of the body. Everything is the same. You go through the gentle elongation stretch, and then the rocking back. When you do the left leg, you use the left hand. And after you stretch both sides, you're going to do this light bridge. And let's go ahead and do that, Laura. Okay, so you do want to start for this. You want to make sure your knees are kind of squared up nicely over your hips. How about with your hands, if you can go on the skin of your belly and just very gently feel like you're moving your skin towards the middle of your stomach. You want to hold that. You do a nice pelvic tilt, and this is this angle with the pelvic bones where you're going to rock the pelvic bones back to flatten the curve in your back. Hold that angle. Gently, in your mind now, you're going to draw your belly button deep into your body, and that tightens the abdominal core. And then picture in your mind if you had to cut off the flow of urine, you're going to lightly tighten the pelvic floor. Now you're going to just hold that tight, but just come up just enough with the tailbone now so that the buttock's off the ground. And then do a count to 5 out loud.
1, 2, 3, 4, 5.
Okay, and try to maintain your tilt. Come down slowly, and then when that tailbone's all the way down, you just rock up and out of it. Okay? And in general, I like to just say, ideally, to do maybe 3 sets. So you do each side and then a bridge, that would be 1 set, and then repeat that 2 more times.